welcome back to the Morning Blend. October is Breast Cancer Awareness Month, and for the thousands of women who have had a breast removed, breast reconstruction may be an option. Join the nationwide movement for the cause and hear with the important information every woman should know. Dr. Jeffrey Roth with Las Vegas Plastic Surgery. Good morning and welcome.
Good morning. Thank you for having me.
Our pleasure. Let's talk about how many women get diagnosed with breast cancer every year.
Well, as we know, here in October is Breast Cancer Awareness Month, and 1 in 8 women walking around are going to have a diagnosis of breast cancer, and so it touches everybody's life.
And this doesn't have to be a deadly disease. There is great treatment out there and available for women.
There is. With the consciousness now that we have that people are coming in for their mammograms a little earlier, they're self-checking earlier, and just as an aside, 1% of breast cancer is male, so it's actually more conscious of coming both for female and male breast cancer as well.
And yesterday was a big day in this movement. It was National Breast Reconstruction Day. What was that all about?
Sure. Well, basically, October is Breast Cancer Month, but there's a piece of the puzzle that some people just don't get, and one of them is actually doing the breast reconstruction afterwards. And the word that we're trying to get out is 70%, that's 7 out of 10 women have no idea that they have breast reconstruction options. Now, that's changing now that we have the consciousness, and in New York, there is now a mandatory law that if somebody is going to go to the operating room to get their breast taken off, you have to tell them about their breast reconstruction options.
Because beforehand, a lot of women didn't know about it.
Only 1 in 5 women get reconstructed after their disease and their treatment.
And so reconstruction means getting an implant to replace that you feel whole again and that both sides are the same.
Well, yes. Basically, a couple things. One is by law, by law, insurance has to pay for it, and they have to pay for the other side. So that's very, very important. And that's been a federal law since the 90s. In fact, Nevada was one of the first states to have it a state law, and then it went federal. But to answer your question is there's a lot of reconstruction options now, and some of the guys and gals that do it do a great job. You can have an expander and then an implant. You can take your own tissue and move it about, and now you can even take tissue from one area and plug it into the other area. And some of these guys and gals that do this all the time do a really nice job. And
then for the people that have gone through a lumpectomy, you don't need to have breast reconstruction.
It all depends.
Do you?
Well, there are lumpectomies and there are lumpectomies. In other words, how big a mass did you take out as to how big the breast is. If you have small breast but with a big lumpectomy, well, that may almost be a mastectomy. So really, it's a case-by-case basis. And what we're trying to get out there is there's some terrific doctors out there, both breast surgeons but also breast reconstruction surgeons, working together. Then you can go ahead and have the best options for the patient.
And your office was involved in this big time. You actually got a proclamation by the mayor here in town.
So,
tell us about this.
So Mayor Goodman was good enough to really recognize the fact that breast reconstruction is important, as is breast cancer awareness is important. So actually, yesterday, October 17th, which is the third Wednesday of the month, is basically a Breast Reconstruction Awareness Day, both nationally and here in the city of Las Vegas.
And you have some upcoming events that go with this as well.
We do. Lots of us here in the community are very active in the community with breast cancer awareness. We actually have a fundraiser that we're doing with the Blue Martini on the 20th. Shameless plug. But it's really not about the doctor per se. It's really about the patient and really getting that information out there, because so many women are coming back 20 years later, 30 years later and going, I didn't know we could do this. And so now you go ahead and, as you said, make them whole again, and that really can make a difference in somebody's life.
And that's another important part. If you've had the surgery a while ago and you did not have breast reconstruction, you can still get it today, for the most part.
Yes, absolutely. So there is a little bit of controversy. Well, do you do it right there when they're at the table, or do you do it later? And that's one of those things that we argue about all the time. Again, I think it's very much up to the individual and what they have to go through. Are they going to go through chemotherapy? Are they going to do radiation, et cetera, et cetera? So that's where the breast surgeon the breast reconstruction surgeon, the plastic surgeon, and the patient really need to work together, along with the oncologist, the radiation oncologist, to try to individualize it for that particular patient.
Dr. Roth, some great information for us. Thank you so much.
Thank you for having me. This is great.
National Bra Day was yesterday, but you can still check out information and get prepared for next year by heading to bradayusa.org. Dr. Roth is the owner of Las Vegas Plastic Surgery. If you have more questions, contact him. His information is right there on your screen.